I'm delighted today to be joined by Stephen Goldstein, who's going to be presenting at the Soft Tissue Congress for the first time, and which is up and coming on Sunday, the 26th of October. For those of you who don't know Stephen moved to Australia in 1999, that'd be right?
That'd be alright.
Yep. Stephen holds a Bachelor of Musculoskeletal Therapy as well as a Bachelor of Education. He is a passionate and innovative massage educator. Delivered his workshops both nationally and internationally, and has presented at some of the major association conferences as well. So a fantastic CV. We're delighted to have you on board, Stephen, this year. And thank you for letting us come into your clinic today and taking the time to speak to us.
Oh, my pleasure, absolutely.
Brilliant. Now, before we go into what you're going to talk about, now fascia, it's the hot topic in the industry at the moment. The work of Thomas Myers and Robert Schleep, it's becoming more prominent in a lot of the workshops that we're seeing, and also a lot of therapists are now starting to integrate it into the practice. The talk you're going to be doing is fascial articulation of the lower limb, which sounds fascinating. So I think for everybody watching, could you just give us a little bit more information on that?
Sure. Well, fascial articulations is really a hybrid. It's looking at the joint involvement along fascial lines.
Okay.
So with the lower extremity, I'm going to begin to focus actually more on the hip joint, the knee joint, and the SIJ.
Okay.
And I'm going to certainly pay attention to the cardinal lines of fascia. So that'll be superficial front line and the back line. So within that construct, because Myers is so familiar, I don't really felt the need to have to do the basics. I wanted to have something a little more left of center.
Okay.
The other thing that's interesting about Myers and the lines is that if the practitioner looks at the high leverage points on the lines, they'll notice that it's not all myofascia. There's ligaments and there's joint structures.
Okay.
So sometimes that's the critical piece in the tension of the line that needs to be reorganized.
Okay.
So what we're going to do with the lower limb is look at that, and I'm going to also blend it because my trademark work is always to pay attention to the nervous system. So weather and fascia is so integrated with the autonomic nervous system that I'm going to use straight leg raises to do what I call lower extremity levering.
Okay.
And I'm going to use, again, to affect the nervous system, low load patient effort. It's really modified muscle energy technique, but geared more towards joints.
Fantastic.
So I've got some quick moves that I work with people, and in this one I really wanted to make it user-friendly. So that some of the techniques people will be able to go home with fairly quickly, and some they'll be scratching their head about.
Right, okay.
Looking at them. I want to do this in a way where we're working on the table. I'm mic'd up, I'll have the PowerPoint going, but I'm going to show what I do in the clinic with this kind of fascial articulation work, and hopefully we'll get to do it on several people.
Absolutely, and that's something that's key about this conference, that we do want to have lots of practical demonstrations, so we're actually going to be able to see that as part of your talk?
Yeah, absolutely. We'll get some, there won't be any ringers. We'll get people in from the audience. Of course, the best laid plans often go astray, so you know, if we have a critical problem with somebody, we probably have to screen just a little bit before they get on, but generally, if somebody's got some real myofascial tension, if they've got generally low back problems, SIJ is not moving really well, this stuff will work really quickly.
Fantastic. Thank you very much, Stephen.
My pleasure. I'm looking forward to all of you coming.
Absolutely.
I'm excited.
And look, we're getting closer to the date now. It's Sunday the 26th of October, and we will be cutting off that enrolment date around October the 14th. There are still a few places available, and if you stay tuned to this video, there's going to be a slide coming up just telling you how to enrol. Stephen is one of 6 presenters that are going to be there, and it's going to be a sensational day. So Stephen, thank you very much again for inviting us to your clinic, and we hope to see you on the 26th. Thank you.